So now we will be talking about very interesting topic, that is how the blood flow is actually controlled by different parameters of blood vessel, that is radius of the blood vessel or something like that. Okay, now before that we are now going to define for you all, that is blood flow. We will at first define blood flow for the first time. Now what is blood flow? With respect to its terminology, blood flow is actually nothing but the flow of blood in a vessel, right, per unit time, suppose. Okay, now a very interesting insight into this blood flow or flow of blood is this, that how can you measure this blood flow? Now there is an equation, clear? There is an equation which actually tells us how to calculate blood flow. There is an equation for that. We will be talking about that equation, no doubt about this, but we will also talk about the shortcomings of that equation, okay, and how we will overcome these shortcomings. Okay, but before that we need to know what is blood flow. Okay, blood flow, or simply a flow, is defined as volume displacement per unit time. Clear? That is, blood flow is equals to volume displacement divided by time. Clear? So this is blood flow. Now what is this? This is actually nothing but blood volume. Now listen with all your attention. This is what? This volume is nothing but blood volume. Now listen with all your attention possible. How to calculate blood volume? We will talk about that later. Blood volume you can actually calculate using a very sophisticated method called hematocrit value determination. Clear? Using hematocrit value we can actually find out this blood volume. So for the first time we are introducing terms in a blood flow equation, where now you can understand that these are calculatable terms. Okay, these terms we can calculate. Blood volume we can calculate, and time we can actually measure. That means when we first started the hemodynamics class, then we were talking about blood flow which cannot be defined, right? But we are now trying to define it, right? Now from this we can write blood flow is equals to delta V divided by delta T. Clear? That is change in volume of blood with respect to time. Clear? But another important aspect you must understand here, that how can you define volume? Right, now listen. Volume is area into displacement, right? Now area into displacement. Why? Because area have unit of L to the power 2 and displacement have L to the power 1. That means in case of volume it becomes m cube, right? Now listen with all your attention. That means we can redefine this concept as A into delta x divided by delta t. Okay, now listen. What is this A? This A is actually the area of cross section. This A is nothing but the area of cross section of the blood vessel through which blood is flowing. Clear? Through which blood is flowing. Okay, through which blood is flowing. Clear? Now a very interesting part you need to understand here is this, that if you take out this area thing, then it will be like delta x divided by delta t, right? That means blood flow is equals to area into delta x by t. Now what is delta x by t? What is this delta x by t? This delta x by t is actually displacement per unit time. That is what? Velocity, right? That means here you can now write this equation as, blood flow is equals to area into V. Clear? Now why this velocity is important? This is actually the velocity with which blood is coming out of this blood vessel. Clear? Now we will be talking about the importance of this V, don't worry. This is the velocity. Okay, Now, actually there is no single velocity when blood is flowing. Fluid actually flows like sheets of paper. Okay, that means the first sheet which is touching the blood vessel will be having least amount of velocity. Now, if you really want to calculate blood flow, okay, then applying this formula will be really tough for you. Why Because blood is a colloid. Clear? Blood is a colloid, and the velocity of colloid depends on many things. Okay, viscosity and other things. Okay, viscosity and the length of the tube or length of the, in this case, blood vessel. Okay, but if you really want to introduce these terms, okay, if you really want to introduce these terms, then you will have to do, what you will have to do is you will have to introduce an equation in this whole thing. This is known by the name of Poiseuille-Hagen ratio. Clear? Or Poiseuille-Hagen formula. Clear? What is Poiseuille-Hagen equation? Okay. Now listen with all your attention. Poiseuille-Hagen equation is actually an equation which define blood flow. Now listen, which define blood flow. Clear? Considering the length of the blood vessel and also the radius of the blood vessel. Now this is very important. Okay, now this is very, very important for you people to understand here. So suppose if I so this is Poiseuille-Hagen equation. F is equals to delta P into pi r to the power 4 divided by 8 eta L. Now listen with all your attention. This r is nothing but radius of blood vessel. Clear? This eta actually stands for viscosity of blood or the flowing fluid. Clear? This L stands for length of the length of blood vessel. Clear? Now I will be asking a very important question here. Okay, now I will be asking a very important question here. Can you answer this question? What is this delta P? Whether it is hydrostatic pressure or driving pressure or transmural pressure. What is this? Now listen. Actually this delta P is nothing but driving pressure. Actually this delta P is nothing but driving pressure. Okay, so actually this delta P is nothing but the driving pressure. Okay, now a very interesting point you need to understand here is this, which is actually hidden in this particular equation. Now listen, what was Ohm's law? V equal to IR, right? What was hemodynamic Ohm's law? What was your hemodynamic Ohm's law? Clear? What was your hemodynamic Ohm's law? Hemodynamic Ohm's law actually looks like this. Delta P is equals to F into R, right? Now, if you make F or flow as the subject of this equation, then this becomes delta P by R, right? Now a very interesting part you need to understand is this. If you now consider or if you now compare this equation, if you now compare this equation with the Poiseuille-Hagen equation, then you will understand a very, very important thing. You know what is that? Now listen with all your attention. If you now compare these two equations, okay, these two equations, then you will understand that this is actually the delta P, right? So delta P is actually present here, this is also present here. Now a very interesting part you need to understand is this. If you just break down like this, then now listen with all your attention. This was your what? Delta P. This is delta P. Now a very interesting part you need to understand here is this. This whole part is actually representing this whole part is actually representing this whole part is actually representing 1 by R, that is inverse of resistance. Clear? Clear? So this is actually 1 by R in disguise. Clear? So Poiseuille-Hagen ratio is nothing but a special case of hemodynamic Ohm's law. Clear? Now, what information we are actually getting, we are directly getting from this Poiseuille-Hagen ratio, right? There are actually two sets of, information. There are actually two sets of information we are getting. There are two sets of information we are getting from this, Poiseuille-Hagen formula or for Poiseuille-Hagen equation. Okay, they are number one. The blood flow or the flow of any fluid is directly proportional to the fourth power of radius of the blood vessel or any vessel through which this fluid is flowing. Okay, fourth power of radius. Clear? Okay, blood flow is directly proportional to the fourth power of radius, that is R to the power 4. Clear? Now listen with all your attention. That means this is very interesting for you people to understand. Suppose this is a blood vessel. Okay, suppose this is the blood vessel. Okay, now suppose this is the radius. Okay, this is the radius. Now blood flow, okay, is directly proportional to the fourth power of radius, right? Now it is very important for you people to understand right now that suppose due to lipid deposition, the radius has been shortened, and suppose the new radius is r prime and r prime is less than r. That means the blood flow will now what? Significantly decrease. Blood flow will now significantly decrease. Clear? Okay. Now listen with all your attention. This is very important. Now we will be talking about the role of aspirin. Clear? Now listen. Now let me tell you another information which we are getting from this, Poiseuille-Hagen equation. Okay. Now listen. Now another, information we are getting from this Poiseuille-Hagen equation is blood flow is inversely proportional to the viscosity, right? Blood flow is inversely proportional to the viscosity of the flowing blood or flowing fluid. Clear? Blood flow is inversely proportional to the viscosity. That means if there is a deposition of lipid and due to this radius has decreased. Now listen with all your attention. Due to this radius has decreased. Now what you will have to do is, suppose the viscosity of the blood was 5. Now what you will have to do? You have to increase the viscosity or decrease the viscosity. To increase the flow of blood, because the flow of blood has been reduced to some extent because of the decrease of radius. Now to increase to maintain the same amount of flow of blood, you will have to what? Increase the viscosity or decrease the viscosity? You will have to increase the viscosity or decrease the viscosity. Flow is inversely proportional. That means if you want to increase the flow of viscosity, you will have to if you want to increase the flow of blood, then you will have to decrease the viscosity, right? Now listen with all your attention. Aspirin, aspirin? Okay? Aspirin does this job. Aspirin actually decreases the viscosity of, blood. Okay? That's why aspirin is given to patients who are having, blockage in their arteries or veins. Clear? Because when there is a blockage in arteries, okay, then to maintain a constant flow of blood, you will have to follow Poiseuille-Hagen equation. Clear? Now to maintain constant flow of blood, what you will have to do? Now listen, due to a decrease in radius, blood flow has decreased. because it is directly proportional. Now, if you want to really maintain the flow of blood, listen with all your attention. If you really want to maintain the flow of blood, same flow of blood, what you will have to do here is this. You will have to try aspirin, okay? Because aspirin actually reduces the viscosity. Clear? Aspirin actually reduces the viscosity and therefore increases the flow of blood. Clear? Now listen with all your attention. When you are, giving a patient aspirin, you must be careful because you must remember that aspirin actually is a blood thinner, okay? The other name of aspirin is it's a blood thinner, okay? It's a blood thinner. Now listen with all your attention. Now it is very important for you people to understand that as aspirin is a blood thinner, therefore the flow of blood will increase. Now if in your body there are some places where intricate and very small capillaries are present, then there is a high chance that that particular area will bleed more. Clear? Due to high blood flow, right? You know what are those areas? Now listen, if you prescribe any patient with aspirin, you must understand that you are actually telling the patient to take aspirin. That means he or she may bleed in their GI tract. That's why you must understand the risk here, okay? Clear? So aspirin is really good. Okay, aspirin is really good as a blood thinner, okay, when you really want to increase the blood flow. Clear? Now, what was the main problem? What was the main problem behind this, application of aspirin and all this? The main problem behind this was actually the lipid, right? Now listen with all your attention. To manage hypertension, now listen with all your attention. When your blood vessel is actually covered by lipid, then blood flow will what? Decrease, right? Now listen with all your attention. Your heart will have to now, now your heart will have to work more. Clear? Now your heart will have to work more. Therefore, heart rate will increase in these patients. Now listen with all your attention. A very important part you need to understand here is this. So if you can actually control this lipid, you can actually, completely, control these parts, this Poiseuille-Hagen equation, right? Now, to actually, reduce lipids, what you can actually give, there are drugs called statins. Clear? There are drugs called statins. Okay? Example of statin is a very important drug, that is atorvastatin. Atorvastatin. Now listen, atorvastatin reduces the risk of heart attack by 20% in a human being. Clear? That means if you apply statins, what these statins will do, what happens is this, atorvastatin actually blocks an enzyme which is known by the name of HMG CoA reductase. Clear? Now what is the role of this HMG CoA reductase, right? What is the role of this HMG CoA reductase? Now listen. In your body, acetyl coenzyme A is converted into cholesterol. Okay? Now listen with all your attention. From where this acetyl CoA comes, right? Now this acetyl CoA comes from TCA cycle. Now from where TCA cycle starts? From pyruvate. From where pyruvate comes? Glycolysis. That means if you take therefore more amount of glucose, there is a high chance that you will, you are actually converting that glucose into your cholesterol. Now listen, if you don't take if you don't take sugar, or if you don't take carbohydrate, if you just take protein and lipid, clear? This type of dieting is called keto diet. Why? Because your body will then and there, after 2 or 3 days, your body will start producing keto acids, okay? Beta hydroxybutyric acid, clear? Acetoacetic acid and acetone. These 3 ketone bodies are enough to produce energy for your body, okay? Now this type of intense dieting is done by those persons who are actually working in a gym very hard, because they want to shed some extra calories. Clear? But this type of diet actually creates very much big problem for your kidneys as well. Clear? That's why it is not recommended that you do, you know, keto diet for more than 21 days. It is not at all recommended. Clear? Now, if you really want to learn why we are not talking about that F is inversely proportional to, now why we are not talking about this? F is inversely proportional to the length of the, you know, vessel, right? Now, this is not in our hand. Yes, we are getting this information. This blood flow is inversely proportional to, you know, length of the vessel, right? But this is not in our hand. We cannot actually, you know, stretch or strain any, you know, any of our blood vessel, right? But we can actually, you know, we cannot actually make lengthy, or, you know, we cannot actually shorten our blood vessel. That is not a very good therapy, at least. But we can actually control this part by utilizing drugs, and this part by utilizing drugs. This is the importance of Poiseuille-Hagen equation, okay? You are actually learning about drugs if you really want to know what is Poiseuille-Hagen equation. Many people actually don't know how this equation is important for, you know, why this equation or how this equation is very much working in your body. Actually, they are working with respect to these things, okay? With respect to drugs, with respect to pharmacology. Clear? So now we have discussed, up till now we have discussed, you know, blood flow, right? Now we know what is the importance of blood flow. Actually, blood flow is one of the most important, you know, thing, because when we were talking about blood flow, we have discussed many, you know, drugs, aspirin or, you know, atorvastatin or something like that, right? Now listen, a very interesting part, you know, to understand is this. Now we will be dealing with total peripheral resistance. Clear? Now we will be dealing with total peripheral resistance. Now, why this particular term, total peripheral resistance, is important? Clear? Now listen, suppose in your blood vessel there are lipid, you know, molecules which are, you know, there, and it is actually blocking the blood vessel. Now remember this for your entire life. You know, there is something called stenting. Many people undergo stent therapy. Suppose they have a, you know, blocked coronary artery, and doctors will prescribe that you undergo stenting, and many people do that and they think that this is safe. This is the most biggest myth in this world. Stenting is not safe, my dear friend. Stenting, you know what do you mean by stenting? Stenting means that the amount of cholesterol or amount of lipid deposition is so much high in your blood vessel that almost your entire blood vessel has been blocked. Almost your entire coronary artery has been blocked. Clear? Now listen with all your attention. If a doctor is saying that you will be undergoing a stenting therapy, or you will be placed a stent, okay, stent is nothing but a meshwork, okay? Stent is nothing but a meshwork like this, okay? It's you know, it's like this. Clear? It's a steel meshwork, nothing else. It's a steel, you know, meshwork, okay? Now what we do is, actually, suppose this is a blood vessel, and suppose this blood vessel has been blocked, okay? Now what we do is, we actually clear this blood vessel manually by an open heart surgery method, and then we place a stent here. Okay? So that this portion, in this portion there is no blood flow obstruction. Clear? That means again we are applying stent because Poiseuille-Hagen equation is not maintained in this area of the coronary artery. And you know why coronary artery is important? Because coronary artery is the only artery which supplies the heart itself. Therefore, if your coronary artery is blocked, your heart will undergo myocardial infarction. How can you actually see myocardial infarction? In reality, there is something called ST disturbances in your, you know, ECG. If there is an ST disturbance, we will talk about that later. If there is an ST disturbance, you will know that this is myocardial infarction. Clear? Okay? Now listen. Now we will be talking about total peripheral resistance. Now listen. Suppose your doctor is saying that you will have to undergo a stenting therapy. Okay? That means your coronary artery, a part of your coronary artery, in a part of your coronary artery, a stent will be placed. That means what, you know? Many of your blood vessels, which you cannot actually recognize also, which you don't know even, they are also having the same problem. But what doctors are saying is this, that at least this coronary artery is totally blocked, we will now have to operate this. Because all other arteries which are blocked, we can actually take care of that. But if you have a blocked coronary artery, you will have a myocardial infarction sooner or later. Clear? That's why stenting is important. stenting doesn't mean that you will live long. No, it totally depends on you whether you will live long or not after a stenting therapy. It totally depends on you. It totally depends on you. Clear? Clear? And your diet. Okay. Now listen, why this total peripheral resistance is important. Okay. Now if I divide the whiteboard into two parts, okay, suppose if I divide the whiteboard into two parts, here we are writing the Poiseuille-Hagen equation. Here we are writing the Poiseuille-Hagen equation. Okay, what is that? F is equals to delta P into pi r to the power 4 divided by 8 eta L. Eta means viscosity, right? Now on this part of the board we are writing the hemodynamic Ohm law. Okay, Ohm's law, sorry. We are writing the hemodynamic Ohm's law. Clear? Now this is hemodynamic Ohm's law. Now we will be converting this equation into this. That means we are now trying to make the blood flow as a subject of this equation. Clear? Okay. Suppose this is equation 1. Suppose this is equation 1. Suppose this is equation 1. And suppose this is equation 2. Clear? Now, a very interesting part you need to understand here is this. Now, if you equate this equation together, that means suppose you put the value of F here, okay, that means delta P by R is equals to delta P into pi R to the power 4 divided by 8 eta L. Okay. Now cancel this delta P. Okay. Now what you will have to do is this: stop the video right now and make R subject of this whole equation. Clear? Now I am solving this. Right? This will come. Now let us further simplify this equation. Okay, that means let us take out the constant thing outside of this things. 8 by pi into eta L by R to the power 4. Clear? Eta L into R to the power 4. Now you may think that why this equation is very important. This is actually peripheral resistance. This R is now called peripheral resistance. Okay, this R is now called peripheral resistance. Okay, this R is now called peripheral resistance. Now listen with all your attention. The importance of this equation is this, that peripheral resistance, now listen with all your attention. The importance of this equation is peripheral resistance, that is R, is directly proportional to viscosity. Right? This is very, very important. That means if you are seeing that a person with a high blood pressure, clear, and a very bad low lipid profile, very bad high lipid content in his blood, that means low lipid profile, clear, low lipid profile, that means cholesterol has increased in its blood, okay, and plus high BP, clear, high BP. If you see these two things, then you can be sure that that person is having, suppose I am that person, okay. Now listen, that person is having a problem in blood flow. That means the resistance have increased. Now listen, introduction of cholesterol in blood will increase its viscosity, right? Now listen with all your attention. Suppose this is a blood vessel, okay? Suppose this is a blood vessel. Suppose this is a blood vessel. Now, a very interesting part you need to understand here is this. Suppose if you add cholesterol here, clear? Now, how can you add cholesterol in blood, okay? You cannot actually add, you will have to add something called VLDL, LDL. Now, if VLDL and LDL concentration is high, then the viscosity already increased. The viscosity is already increased if you add VLDL and LDL, okay? If the person is having VLDL and LDL concentration high as well as chylomicron concentration high in his or her blood, then you can actually assure that person that he is having a high viscosity in his blood or her blood, and that's why his or her peripheral resistance has increased. Clear? His or her peripheral resistance have increased. Now listen, when peripheral resistance has been increased, when peripheral resistances have been increased, now that means decrease in flow of blood, right? Now listen with all your attention. How can you actually investigate these cases, okay? These are very much, rampant in a population of so much, huge people like India. Now listen, suppose this is a blood vessel, okay? Now listen, suppose 50%, okay, 30% suppose of this blood vessel has been blocked. That means only this portion has been used so that blood can flow, right? Only this portion is constantly being used so that blood can flow, right? Now listen, if this happens that lipid concentration has increased, and due to this the blockage has been increasing, okay? Now a very interesting part you need to understand here is this: when the radius is becoming smaller, then the blood pressure will increase, right? That means in these cases the person will be having high BP, low blood flow, right? Low blood flow means what? Heart will have to work faster. That means that person will also have higher heart rate. That means in this case, this may happen that Mary's law may fail. Now, what is Mary's law? We will be talking about that in details, don't worry. What is Mary's law? In simple words, Mary's law is nothing but when BP is high, heart rate is low. That means BP is inversely proportional to heart rate. That means suppose if there is a person who is actually sweating, all these things. Now, if you just check his or her heart rate, and if it is less than 72, suppose 60, then you can actually assure that person that when his or her heart rate is low, that means her or his BP is high. Now, Mary's law holds good, okay, most of the times, but in many cases this Mary's law also fails. But in most of the cases, suppose you don't have any sphygmomanometer at home, but you really want to know that whether this person is having a high blood pressure or low blood pressure, just check his or her heart rate. Clear? Then you will be able to guess at least that whether his or her blood pressure is low or high. Clear? Okay. Now, why I am talking about this thing, okay? Now listen, when cholesterol level concentration or chylomicron concentration or VLDL concentration increases, then viscosity increases, peripheral resistance increases, clear? Flow decreases, heart rate increases, these things are happening. Clear? Now listen with all your attention. A very interesting part you need to understand is this. Now, this high blood pressure is very much bad for, our health, right? Now, to overcome this high blood pressure, we will be applying a very important, drug. You know what is that? That is called telmisartan or losartan. Telmisartan is given to those person who is having this condition. Clear? Now listen. High blood pressure is very much dangerous for your kidneys, okay? That's why telmisartan or losartan is given. Clear? Losartan is given. Telmisartan or losartan is given. Now listen with all your attention. Another thing you must understand, when this person is showing a very bad, low quality lipid profile, okay, when this person is showing bad quality or low quality lipid profile, then you will have to give that person together with telmisartan or losartan. Telmisartan 40 milligram, okay, clear? Now listen, together with telmisartan or losartan, okay, you will have to add another thing, that is atorvastatin. Now if the person also says that sometimes what happens is this, I become very much nervous, okay, and I don't know what to do and I feel very much nervous or something like that, then you will have to add another drug. You know what is that? That is propranolol, okay? That is propranolol, okay? Beta receptor blocker or beta 1 receptor blocker. Clear? You will have to add another drug, propranolol, okay? But you will have to ask the patient first, okay? So this is actually the important thing you need to understand here, that is the total peripheral resistance is directly proportional to the viscosity. That means whenever VLDL and LDL concentration or chylomicron concentration increases, that means your peripheral resistance is increasing. Why? Because your viscosity is increasing, okay? So now we will be discussing in details the viscosity, okay? Now what is viscosity? Viscosity is actually the lack of slipperiness between two layers of a fluid, okay? So what is viscosity? So what is viscosity? Now listen. Viscosity is lack of slipperiness between two layers of a fluid. Clear? Now a very important part about viscosity is this, you need to understand, that is viscosity is unrelated to the vessel in which the fluid is flowing, okay? That means viscosity is actually an intrinsic property of the fluid. Clear? It's an intrinsic property of a fluid, okay? Viscosity is equals to shear stress by shear rate, okay? Now this is very important for you people to understand what is shear stress and shear rate, okay? Now if I tell you that shear stress is equals to force divided by area and shear rate is delta V divided by delta X, probably you will not understand. Now I am trying to give you people an example, okay? Now suppose this is first layer and suppose this is the second layer, okay? Now listen with all your attention. Suppose I will be now dragging this first layer, okay? That means I am moving now this first layer with respect to this second layer, okay? Now if this happens, that when I am dragging this first layer, the second layer also starts moving, okay? Suppose I am dragging this first layer towards me and this second layer was supposed to be what? At rest, but it will, if it starts moving, then we will have a relative velocity here, right? That means suppose this is a suppose this is a sheet of paper, okay? Now this is suppose another sheet of paper, okay? Suppose this is another sheet of paper. This is another sheet of paper. Now listen, suppose this is the first sheet of paper and this is the second sheet of paper, sorry. Now listen, a very interesting part you need to understand is this, that suppose if you are trying to snatch this first sheet of paper, then suppose suddenly the second sheet of paper also starts moving. Clear? Then you will not get an absolute velocity, right? You will get a relative velocity. Now listen, suppose this particular page was moving with a velocity of small v, okay? Moving with a velocity of small v. Now that means this page must be moving with a velocity of v plus small v, right? Clear? Now listen, the distance between these two sheets are suppose delta x. Clear? The distance between these two sheets are suppose delta x. So this is actually your shear rate. Clear? This is actually a shear rate. Now listen with all your attention. Now what is delta v? Delta v is the difference between this and this velocity. Clear? Difference between this and this velocity. Okay. Now what is shear stress then? Shear stress is the force, is actually the force which is required to actually displace this first sheet. Clear? Now this force when divided by an area of, suppose in this case this is the area of the sheet, okay, then this is called shear stress. Okay. Now why these things are important? Now listen, actually if you really want to learn, now a very important point you need to learn here is this. Actually the unit of viscosity, unit of viscosity is actually poise. Okay, P-O-I-S-E, poise. Clear? Now listen with all your attention. Viscosity of blood, viscosity, to be very honest, viscosity of whole blood means with plasma. Clear? Whole blood is almost equal to 3 centipoise. Clear? Is almost equivalent to 3 centipoise. Now we will be applying this concept of viscosity in a real life situation. Okay. Now listen. Suppose this is a blood vessel. Okay. Suppose this is a blood vessel. Okay. Now important part you need to understand here is this. Suppose now listen, this is actually the force gradient, or the velocity gradient of flowing blood. Okay. Now listen with all your attention. Suppose this is actually the layer 1, this is the layer 2, this is the layer 2, this is the layer 3. Okay. This is layer 4 and this is layer 5. Now interesting point you need to understand here is this, that if you now join these velocity heads, okay, if you now join these velocity heads, now here again you will get these velocity heads, okay, I am not drawing, then you will get a bullet shaped structure, right, if you join these velocity heads. Okay. Now important point you need to understand is this, that what this diagram is representing. What this diagram is actually representing is very important. Now listen with all your attention. What this diagram is actually representing, the first layer which is actually associated directly with the blood vessel layer, this particular layer or this particular layer of blood actually cannot move freely because it is having a touch with this blood vessel, right? That means this particular layer of the fluid or blood, okay, is facing maximum amount of force of resistance. Clear? Now this force which actually resists the first layer to get a very high velocity, this force is actually called cohesive force. Okay, this is called cohesive force. This is called cohesive force. Now listen, due to this cohesive force, the first layer is moving with a very little velocity. Second layer is having a cohesive force attachment with the first layer, therefore it is moving with a slower velocity with respect to layer 3, but with an increasing velocity with respect to layer 1. In this third case, this is having a cohesive force relationship with the second layer, therefore this third layer is moving with an increasing velocity with respect to second layer, but with a lesser velocity with respect to fourth layer, and the fifth layer is moving with the highest velocity. Clear? Fifth layer is moving with the highest velocity. Clear? Is moving with the highest velocity. Okay. Now, so this is actually your profile of viscosity and what role does viscosity play in the different velocity layers of your blood. Clear? Okay. Now what happens is this: suppose you add aspirin. Okay. Suppose you add aspirin. Now what happens? Aspirin is a blood thinner, right? It's a blood thinner, right? Right? It's a blood thinner. Now how aspirin will actually change this, now listen, as aspirin is blood thinner, that means aspirin will reduce viscosity. Aspirin will reduce viscosity. Now when aspirin is added, that means the same blood will now have a velocity profile, which is now the same blood will have a velocity profile, no doubt. But when aspirin is added, the first important change you will observe is the bullet tip velocity profile of your blood. This bullet tip is now becoming more and more pointed. Okay, bullet tip is now becoming more and more pointed. Clear? Bullet tip will now become more and more pointed. That means the median velocity of the blood is increased a lot when you add aspirin. Clear? That means blood flow is increased. So this is the velocity profile picture of your blood when you add aspirin and when you don't add aspirin. Okay, now a very important part to understand is this: there is a misconception that blood flows in a laminar fashion. Okay, now this is wrong, already. And how this laminar fashion flow changes, okay, this we will be talking about in the next class. Okay, and then we will be discussing about Reynolds number and its concept and its application in cardiovascular physiology. Okay.